our Honorable Magahaga, Governor Leon Guerrero, as well as our Segundo Magalahinguahan, Lieutenant Governor Josh Tenorio.
Hafaday. Today it is my duty to deliver the gravest news a governor can relay. At 11:32 today, a second patient confirmed to have COVID-19 passed away. He was 79 years old with multiple comorbidity. He had colon cancer and a traumatic spinal injury. He presented at GRMC with a fever but no travel history, and he was transferred to GMH on March 25th. His family had made the difficult decision to implement both a do not intubate and do not resuscitate order. And while there are no words that can truly bring comfort in times like these, I ask that we each take a moment of silence to honor this person's life and the family and friends he left behind. On behalf of Jeff, myself, and our family, know that everyone who loved this person and everyone who called this person a friend has our deepest condolences. Yesterday, we had 2 additional confirmed cases of COVID-19. The day before, we had 1. But our most recent tragedy indicates that we cannot decrease our vigilance. We cannot become comfortable, and we cannot surrender to complacency. You are not invincible. No matter how healthy and active you are still at risk. These COVID-19 numbers are not today's numbers. They reflect transmission between 12 to 18 days ago, onset and course of illness 7 to 14 days ago, and hospitalization and testing 7 to 1 days ago. The pandemic will either accelerate beyond the capacity of the healthcare system or decrease to containable levels. As we have seen in other countries, testing is key. By testing as many people as possible, you can diagnose and immediately isolate cases and institute rigorous tracking and precautionary self-isolation of close contacts. Ideally, we would be able to test and treat everyone who displays symptoms, but unfortunately, that is not the world we live in. Test kits are limited, not just here, but around the globe. The best you can do is act like you have been infected. Social distancing protects your family, your friends, our healthcare workers, grocery store workers, gas station attendants, hotel and restaurant employees. By staying home and refraining from being in contact with someone outside your family unit, you cut off the virus's chains of transmission. From what we know about COVID-19 to forestall the future collapse of the healthcare system, these steps must be taken immediately before they feel proportionate, and they must continue for several weeks. The good of all depends on the sacrifices of many. I know that it's hard to find the light in the darkness, but there is no force more powerful than hope. That is why we continue to recognize our COVID heroes. Today's COVID hero is Hilton Guam Resort and Spa. Hilton donated supplies to GMH to assist them as they work to keep us healthy and safe. I continue to be humbled by the extraordinary efforts demonstrated by our island's medical personnel and the community in supporting them. Before this is over, we might find more days filled with grief, but these days must strengthen our resolve. They must give us the will we need to prevent more loss and to save others from sadness. I am your governor. That is our mission, and we will not stop until we have won the war against COVID-19. I'd like to bring up Linda DeNorsi to give you more update of our COVID cases.
Thank you, Governor. As the governor indicated yesterday, we had 20 tests done, and of the 20, 18 were negative and 2 were positive. Testing from March 12, 2020 to March 30, 2020 are a total of 410 tests. Of that amount, 352 were negative, and 58 were positive. In regards to the demographic location of these COVID positive patients, 20 reside at the northern region of the island, 24 from central, 11 from the south. We have 2 homeless and 1 pending determination. In regards to the age group, again, 0 to 19, there are no cases at all. For the age group of 20 to 29 years of age, we have 5 patients. From the age group of 30 to 39, 6 patients. 40 to 49 years of age, 10 patients. 50 to 59 years of age, 11 patients. 60 to 69, we have 16. 70 to 79 years, 6. 80 to 89 years of age, 3 patients. And those aged 90 and above, we have 1, for a grand total of 58 COVID positive patients. In regards to the gender, 31 are female, 27 are male. In regards to the medical status of these individuals, 30 are stable, 19 are hospitalized, and of the 19, the breakdown are as follows. GMH inpatient, there are 6. In the ICU unit, 4. In the SNU unit, 9. 7 have fully recovered, 2 have died. Thus, a grand total of 58 patients. In regards to the travel history, we have 1 from Japan, 8 from the Philippines. There are no travelers from South Korea. There are 3 from the US mainland, and 46 have no travel history at all.
Thank you, Linda. In my opening statements, I talked about our healthcare delivery system, and I'd like to bring up Dr. Annie Berdalio, our medical director at the Guam Memorial Hospital, to talk a little bit about capacity and what we are doing to try and increase it. Dr. Berdalio.
Hello, good afternoon. As we have tried to contain and isolate these cases at the hospital, the one message across all of the studies, all of the experience in Wuhan and the US, is the number one thing we can do as medical people, as the public, as patients, is to stay home. All of our staffs and all of our clinics are isolating all of our patients as much as possible. We are decreasing how many people come to the office. The fewer contacts you have with anybody, the better. At GMH, our main goal is to isolate all our COVID positive patients into contained units. No patients are in contact with each other. The emergency room is receiving 1 patient at a time. Each patient is screened in separate areas outside the facility and then individually placed in appropriate units. Nobody waits in a waiting room and mixes with anybody else. We have the capacity to isolate 36 COVID positive patients at the main facility, and we have 60 isolation beds up at the SNF. Currently, we have 10 COVID positive patients in the GMH facility. We have 9 up at the SNF, and we have 2 in the ICU. We have patients that are particularly vulnerable in our facility. These are non-COVID patients who are ill. Our first order of business is to move them out of the hospital. We have SNU patients that are elderly, and we are in the process of moving them out to other places. GRMC is in daily contact with our nursing staff to move out the other ill patients from the ICU, the telemetry floor, and the med surgery floor. The limiting factor is really our healthcare staff. Trying to move them to where they are needed so that we can create capacity is our #1 goal. They, along with the elderly, are really the patients at most risk. So getting them the equipment that they need to take care of these patients has been our #1 priority. After we move these patients, we have more capacity than we have staff. There's been a lot of talk about moving the MCH areas. Those are our labor and delivery units, our pediatric units, our neonatal ICU units, and nursery. Fortunately, the experience has been that these are patients that for some reason aren't as vulnerable. So although we are making plans to move them, we want to move the other patients first. It is a trying time right now, and there's a lot of fear out in the community. The best recommendation is to talk to your family via FaceTime. I FaceTime my mom every few days. Don't gather. Don't come to barbecues. Don't go out. If you stay home, that is your best bet. I'm an OBGYN by training. I still take OB call. So my patients come and have to deliver as well. The L&D unit and the OB floor, as well as the nursery, just by the design of all hospitals, is away from any infection unit. Every day of every year, we have infection patients in the hospital. We have tuberculosis. We have highly contagious viruses we don't even know about. Those patients always go to isolation units away from the L&D. So when you come in as a pregnant patient in labor, you are screened just like everybody else, because you could have COVID-19 as well. And just because you're pregnant, we can't assume you don't have it. So we require you to enter the hospital just like everybody else. You get screened, we go one at a time, and if you don't meet any risk factors, you go straight to the labor and delivery. Patients that we have not had a COVID positive pregnant patient yet, but we do have plans to isolate them and deliver them as well. Our main concern at the hospital right now is to get these elderly people to where they can be cared for. And that's how we're creating capacity.
Thank you, Dr. Berdalio. We're open for questions now.
Kevin Kerrigan from the Post. I'm not going to keep.
Good afternoon. Can you hear me all right?
Yes.
Can you tell us why you asked for the emergency session to be canceled today?
You know, I did not ask really to cancel it. I was informing the speaker that the bills that are being put forward are bills that require funding sources. And what I had wanted to do is to hold off on those bills so we can look at what exactly we have in terms of federal monies, what exactly we have in terms of local monies, so we're not, so that we're accessing monies that are actually available to be provided. And so what I wanted to do, Kevin, is I wanted to have an inventory of all these federal benefits and assistance. You know, there are 3 packages that was passed on the federal level, almost 2 weeks apart of each other, and totaling over $2 trillion. And we are getting those assistance. So I wanted to make sure that if there's any issues about help to our individual residents, if there's help for our SBA, for our business people, that we look at what our federal assistance are so we can plug those in. So I had asked the speaker to let's meet and let's look at all of this so we can have a much more organized way in terms of providing assistance for our people. There's monies coming down for tax rebates. There's money coming down for individual assistance. There's money coming down for unemployment programs, new pandemic unemployment programs, just to address those states and those territories that don't have unemployment insurance. There's money coming down for the hospital in terms of expenses related to coronavirus. There's money coming down from public health in helping also for prevention measures and treatment measures, surveillance, contact tracing, all of those expenses that we are incurring right now using our local funds and payments from our local funds. So what I wanted to do is have a better idea of all that's out there. What are our expenses so far? What can our local funding do? What can the federal funding do? So that's basically, I had asked her to let's regroup and let's look at this whole thing in a much more, I think, knowledge, information, and so forth. So we can provide the help that we need for our community.
Thank you, Governor. And as a follow-up, can I ask you or perhaps Public Health Director DeNorsey to give us an overview of the status of testing? How many test kits are left? Have we gotten any from the military or any more from the CDC? And the status of DLS testing. We've just received word from one of our listeners that DLS, or at least the DLS number that they called, is not providing testing. Are they or aren't they? And what's the status of the rest of the testing, please?
All right, so in relation to more test kits, I know that we've been working very closely with FEMA, with CDC, and also with the military. I just had a call with Admiral Minoni this morning, and they're bringing in test kits also, and they've included our requests from that. So he's looking to bring about 400 tests for Guam. He has also offered that we could send our test specimens along with what their test specimens are off island if we need to. And I know there is a contract with DLS because one of the directives from a federal level is also to source out what you have in terms of your local commercial laboratories, your local vendors. So those are the sources for getting the tests here. So Linda can give you more information about what exactly we have left, how many we have done, and so forth.
Yes, thank you, Governor. As far as right now, what we have left is 348. And this week I was notified that another kit is coming its way by this week, hopefully. So that's what we have so far.
And DLS is testing.
DLS, yes, we have a contract right now with DLS, and so they are working with us where they can also do the testing through Hawaii and also through Quest, which is in California. And so we already signed that agreement from the beginning. Yes.
Thank you.
So Kevin, can I just also add something here that might help? All the tests that are being tested have to be ordered by a physician. So the flow is you get those patients from the private clinic. So they go to the private clinic, they get assessed, and then the doctor will make the evaluation. Yes, you're a PUI. Yes, you're not. Yes, you need a specimen. Yes, you're not. Then of course GMH also is another source for this testing, and GRMC is another source. SDA, the Public Health Northern, Southern, Central Clinics is another source. And so, but they're all routed through public health because there is a federal directive and also our local directive that all tests have to come through public health. And the reason for that is because public health needs to monitor and track and track these data and the results and so forth. So people can't just go to DLS to be tested. They need to have a specimen that's a specimen that's gotten through any of those areas of entry.
Thank you, Governor.
Sure. Thank you, Kevin. Nick Delgado, Guam Daily Post.
Hi, Governor.
Hi, Nick.
First, I want to add into my sincere condolences on the family of that 79-year-old man who passed away this morning. I wanted to ask, have you made contact or reached out to the family? If not, do you plan to? And then where are we at with the trace investigations for those who may have come into contact with him?
Okay, so probably Dr. Jolene can talk about the trace investigation. I have not reached out. I just found out about maybe an hour ago. I have wanted to, call the family, although I'm not going to physically be there, because the rule is less contact as possible. So I am sending my condolences through this media forum, but also I will try to call the family and offer my condolences. So Dr. Jolene could probably talk to you more about contact tracing with the family.
Hapade. The family was actually contacted. They were aware. Patient was actually placed in a comfort care and started on a morphine drip early this morning. So the family was already aware that this was going to happen, and then passed at 11:32 this morning, and we're also informed. As far as the contact tracing, public health has been actively investigating this since he became COVID positive. And Linda DeNorsi would have more details on that later. Do you have any more questions for me?
No, thank you so much.
Go ahead, Linda, talk about the contact.
Oh, yes. We currently have our investigators and also our surveillance team at the Department of Public Health. And yes, they've been doing all their surveillance and contact follow-up. All these households, if they are in close contact with them and they experience any type of symptoms, they automatically will be tested to confirm whether or not they're infected. In regards to that, once they are infected, then we will continue to monitor them. And again, we will either identify if their home is suitable. In other words, we can put them in home isolation if their symptoms are very mild or they're asymptomatic. It doesn't warrant them to be at any hospital, to be hospitalized, or any acute care services that needs to be done through GMHA. If, however, the home is not suitable, i.e., for example, they have elderly living with them, or they have other family members in the home that has comorbid conditions, then we have to remove them and place them in an isolation facility, and that is with a government facility.
I'm sorry, did you say how long the patient was at GRMC?
It was with Jimmy.
Or GMH?
Yeah. Hold on, Nick.
So the patient was transferred from GRMC on March 25th, initially presented to GRMC on March 24th. Swab was done at GRMC and then confirmed while the patient was at GMH.
Thank you for that clarification. And so my second question, we noticed a drop by at least half in recent days in the number of tests being performed locally. Is the demand for testing, has it been that low?
I have the answer to that question. The testing was done because those were the only specimens that we received. I'm told today that 40 tests will be conducted. Again, it will be dependent upon how many are received, and then that's the reason why the past couple days that has happened. Today, I know they're going to run 40 tests. So I hope that answers your question.
Thanks, Linda. I know last week you said there is no backlog of specimens, and that remains the case.
Right. Right now, that's how we're running it, and if at all, we're continuing that path.
Thank you all so much.
Thank you, Nick. Johanna, Pacific Island Times.
Half a day, can you hear me, Governor?
Yes, I can, Joanna.
Okay, hi. Well, my first question would be, is this the worst economic hit for Guam?
Yes, in all the history of past disasters and past crises, I am told this is the worst economic situation that we are experiencing.
Okay, and my next question is, if there's going to be more samples from Saipan coming in.
Yes, I have been in communication with Governor Ralph Torres, and Linda has been in communication with Esther Muña, who's the head of public health over there. And we are receiving samples from them. In fact, Linda says there's about 10 that came in. Because we are the regional laboratory here, Joanna, those test specimens have to come to Guam to be tested.
Thank you,
Okay,
Joanna.
thank you. Thank you.
Anamita, Pacific Daily News.
Hi, this is Anamita with Pacific Daily News. So will we be at all impacted or slowed down by having to test for all of the neighboring islands?
Slow down in terms of our own testing?
Yes, so does that reduce our capacity for testing? Does that slow down our process for testing by having to test?
I think, I don't think it's gonna have a negative impact because we have the personnel that's here, and also their quota for kids from those islands are also being given to us.
Okay, and
So we will continue with the operations of the laboratory and the testing as we have.
So many residents do continue to ask for a rent suspension. So while they will not be evicted, many residents still lack the income to pay their rent. Are you considering any action on rent payment?
Not a direct rent payment to them, only that we are asking through our executive order to not evict these individuals. However, with these individuals that are unemployed, they will be getting the weekly unemployment economic benefits that we have through the pandemic unemployment benefits program. And so those dollars should be used towards rental payments.
So there will be no rent suspension action?
There is not, when you say rent suspension, like don't pay your rent, I think the fact that they can't pay their rent and they're not being evicted is, in all purposes, a rent suspension.
All right, thank you, Governor.
All right.
Rianne, Mariana's Business Journal.
Hello.
Hi, Rayan.
Hi. So my question is, are you or Linda be able to share like more demographic information about those 7 people who recovered from COVID?
I don't know, Linda, do you have those demographics? How many are women? Where are they from? We don't have it right now. We will get those.
Your follow-up question, Rianne?
Hello.
Your
Hello?
follow-up question?
I think she's got bad reception.
Moving on, Nestor from KUAM.
Take Rayon's question as well. Do I get 3?
You're so creative, Nestor. You're
Well,
like the I yield my time to the next senator kind of thing.
Yeah. Yeah, basically she's yielding it. Afternoon, Governor. First of all, can I ask more about the 79-year-old? Did he have any connection or relation or contact with any of the current, the 58 or so that, or 57 that are currently positive?
Linda, do you know?
No, we'll find out.
We'll find out in the contact tracing, yeah. You mean like, was he one of the hemodialysis patient, or did he go to bingo and that kind of stuff, right? We'll get that information. I'm pretty sure they've tracked that. I'm pretty sure they've tracked that through their surveillance, but we don't have it offhand.
Okay. Yeah, that'd be important to know. Anyways, tomorrow is the first of the month. A lot of people are out of work, been laid off. You know, I would think that if they had a choice if they had to pay rent or buy groceries, they're going to buy groceries because we've got a moratorium on evictions. But it will likely take more than just a few weeks, realistically, for money to come down from the federal government. Is there any local funding that's being planned to help? You know,
well, you know,
these folks
so,
between that time?
Yes, so Nestor, we do have public services right now. We have food stamps that they could qualify for. We have public assistance that they could qualify for. They can qualify for Medicaid. They're also getting tax returns out there. We've given out tax returns out there. So right now, currently, immediate help would come from those programs. Public assistance, general assistance through public health, the SNAP program through public health, and again, for healthcare, MIP, and Medicaid.
So folks who have been recently laid off are qualified now for SNAP?
They should go and apply for those. Yeah. You know, we have you know, the 311 number, right? So we have that. I think there's a extension for those kinds of questions. Yeah. Okay.
And then maybe Dr. Bordelli could, do you have a timeline for when you want to, for lack of a better word, evacuate all the non-COVID patients from the hospital?
Okay, so
and where would you?
I'll have Dr. Bordelli answer that.
And where would you put them?
Yes, so, you know, immediate evacuation of our elderly population is our first priority. So the SNU patients, we are trying to find a place for them. We are contacting St. Dominic's because they have hospital beds and they have capacity. We are offering, I think the medical advisory group has, and the HPLO has identified staff that is available from DOE, from the UOG nursing units. So we are, wherever these patients go, we'll send a couple of nurses from that pool because they will not be in COVID units and they're not acute care patients. So that's our first priority, and we're hoping we can accomplish that in the next day or two. But again, it's getting the space approved and moving the patients isn't really the difficult part. It's identifying staff. Our administrators who run the SNU unit will be in charge of managing those patients as well. Does that answer your question?
Yes, thank you, Dr. Bordelli.
GRMC has really been quite helpful. Again, our nursing staff, our nursing administrators, all of them from GRMC, from GMH, and the HPLO, they are working together on the whole pool of nursing, and they are assigning the nurses to where the patients need them. So again, our second priority is to try to get GRMC staff so that they can open beds for the next group of people, which are really our non-COVID med-surg people. But like always, not just today and in these past 2 or 3 weeks, getting nursing staff has always been a challenge. So that is really the major shortcoming, and we're trying our best to get all the nurses that are out there and available to go to GRMC so that they can open more beds so we can move these patients there as quickly as possible.
Thank you, Nestor. This last question's from Rianne, who got cut off.
Can I just do some follow-up here? I think it was Nestor who asked about the patient who just passed away. Her, or I don't know who it is, he or she, is based on their contacts.
So I just want to make sure that I clarify, the patient who passed away did not have a travel history, was not exposed to a traveler. This was a community contact, and there is one other individual that also tested positive for COVID-19.
The last question is addressed to the governor. Her question is from Rianne. Who is paying for lodging, food, etc. of those in the quarantine facilities?
That's it. Okay, lodging, food, and shelter is being paid by the government.
And now for closing remarks from Lieutenant Governor.
Thank you very much. Again, we want to emphasize for the people of Guam to please stay home. And as we said earlier, when you have to go and get those needs, try and figure out how to consolidate that to minimize the amount of time that you're out there. The other thing I wanted to remind everybody is that we know that when you're at home, sometimes there's a lot of crisis, there's a lot of stress. So if you're in need of some help, maybe to speak to somebody, please call the crisis hotline at 647-8833. That's 647-8833. If you have somebody that you need to talk to. For parents and grandparents that have young children, yesterday, Department of Education launched a portal. This is their first wave of providing some resources for your children to continue learning. PBS also has launched some information, and if you have YouTube or the internet, I would point to you that PBS is also pushing out some lessons and for your kids. And finally, for all of you that really want to be calm out there and really reflect, let me just remind everybody, last year we just celebrated our 75th liberation. And I point that out because in the past, the people of Guam, they suffered 2.5 years of an enemy occupation, and were able to get out of that in a very, very vibrant way. And so as we continue the sacrifice, let's remember that the greatest generation went through a whole lot worse. And so I just point to you to continue your faith and reach out to people, speak on the phone, speak on FaceTime, download Zoom, all that kind of stuff. But we ask you again, please stay at home, and to the media, thank you for bringing this to the people of Guam.
Thank you, everyone. See you tomorrow at 1 p.m.